Welcome to this explainer. Okay, today we are taking a highly debated and, let's be real, pretty abstract economic theory, the crowding out effect, and throwing it into a real-world reality check. We're going to see exactly how this macroeconomic concept secretly impacts our daily lives and the policies that govern them. Because this central mystery, it sits right at the very heart of macroeconomics. It asks a huge, fundamental question. What actually happens to private markets, to everyday businesses, and to all that smart money when the public sector steps in with massive spending? Do they just happily coexist, or does the government literally push the private sector right out of the way? So, here's our roadmap for today. First, we'll cover what crowding out actually is. Second, we'll look at the macroeconomic extremes. Third, a real-world case study on healthcare. And finally, strategies and trade-offs. Part 1. What exactly is crowding out? At its core, crowding out is basically a massive tug-of-war between the public sector and the private sector. It's usually triggered by expansionary fiscal policy. So, in plain English, when the government starts spending a lot more money, private industry spending drops as a direct result. Now, this concept actually breaks down into two distinct mechanisms. On one side, you have resource crowding out. This is where the government uses up funds, labor, or physical resources that otherwise would have gone straight to private enterprises. On the flip side, there's financial crowding out. This happens when heavy government borrowing just sucks up all the available capital in the room. That raises interest rates, and suddenly, borrowing becomes way too expensive for private businesses to invest and grow. To make this a bit more concrete, imagine the smart money in the pharmaceutical world. Let's say private companies are happily supplying 100% of the headache pills for an entire economy. But suddenly, out of nowhere, the government swoops in, declares that headache pills should be free, and starts manufacturing half the supply. Literally overnight, that government intervention completely kills a massive private investment opportunity. It directly crowds out 50% of the private capital in that market. Poof, gone. Moving on to part 2, the macroeconomic extremes. When we look at this, we can heavily contrast two very opposing theoretical views. The classical view basically argues that government spending completely kills private investment. Total, full crowd out. On the flip side, the Keynesian view argues that, well, under certain conditions, government spending doesn't affect private investment at all. Zero crowd out. Let's dig into that Keynesian perspective first. You often see this during deep recessions in what economists call a liquidity trap. Imagine an economy so bleak that people are literally hoarding cash under their mattresses. They have absolutely zero interest in buying risky bonds. Because interest rates are already sitting right at rock bottom, the government can spend heavily without altering those rates one bit. Private investment isn't harmed at all. The end result? Zero crowd out. But the classical model views the economy entirely differently. Think of the money supply as a strictly fixed pie. Because every single dollar is already fully utilized, if the government suddenly decides to grab a massive slice to spend, interest rates are going to spike. This higher cost of borrowing causes a direct one-to-one drop in private investment. For every single dollar the government spends, a private business loses a dollar. That is your textbook full crowding out effect. Okay, so having established these two wild theoretical extremes, where government spending either completely destroys private investment or has absolutely zero negative impact, the most natural question to ask is, well, which one actually happens when real policies hit the real world? That brings us to part 3, a real-world look at healthcare. Let's look at the State Children's Health Insurance Program, or CHIP. This was designed to subsidize health coverage for low and moderate income kids. In this specific arena, crowd out happens if public funds simply substitute private dollars. For instance, What if people drop their employer-based coverage? Or what if employers just stop offering dependent options entirely simply because this new, better, or maybe just cheaper public option exists? Now, what is really fascinating here is the hard data. A congressionally mandated evaluation of 10 states actually gave us authentic, on-the-ground numbers showing exactly where CHIP enrollees came from right before joining the public program. And the numbers? They paint a wonderfully messy reality. The biggest chunk, 42%, were previously entirely uninsured. Another 29% came from Medicaid, but look at that 28% block. They previously had private coverage. This right here immediately proves that the real world doesn't perfectly fit either economic extreme. It operates in this very gray area right in the middle. But hold on, we have to look a bit closer at that 28%. Researchers found that half of those families actually lost their private insurance involuntarily, mostly due to job changes. Another huge segment simply couldn't afford the premiums anymore. When you filter all of those out, it turns out that less than 7% of all recent CHIP enrollees actively dropped their private coverage just to jump over to the public option. However, measuring crowd out isn't just about surveying individual families, it is also about analyzing employer behavior. If you rely on a broader definition that includes employers changing the benefits they offer in response to CHIP, the Congressional Budget Office estimates something pretty huge. For every 100 children gaining public coverage, there is a corresponding reduction in private coverage of somewhere between 25 and 50 children. So a significant substitution effect absolutely does exist. Which leads us to part 4, strategies and trade-offs. Because we know this substitution effect exists, states have deployed quite a few anti-crowd-out strategies over the years. The most common one is requiring a waiting period, basically mandating that a child be uninsured for 3 to 6 months before they're even eligible for the public program. Other strategies include charging premiums and co-payments, so the public option isn't overwhelmingly attractive compared to private plans, or even offering premium assistance to help families just afford their existing employer-sponsored care. So, here is the absolutely crucial point. By design, these anti-crowd-out policies work by creating new barriers. They purposefully make it harder for eligible children to enroll. This literally pits economic efficiency against human empathy. And it carries a really high price, potentially leaving vulnerable children uninsured and delaying necessary medical care, all just to protect the private insurance market. We also have to remember that many families have what policymakers call good cause for forgoing private insurance entirely. The harsh reality is that employer-based coverage is severely skewed by income. Only 53% of low-income children live in families that are even offered employer insurance, compared to a whopping 91% of higher-income children. For many of these families, private insurance isn't being crowded out by the government. It was literally never an option to begin with. Recognizing these severe human trade-offs, states have actively adapted their policies over time. For instance, Pennsylvania totally exempted infants under age 2 from waiting periods, recognizing that early developmental screenings are just way too critical to delay. In fact, after observing that the actual rate of crowd-out was relatively minimal in practice, over a dozen states have either significantly reduced or just completely eliminated their waiting periods altogether. Ultimately, despite all the theoretical macroeconomic risks of crowding out private money, the consensus among many leading health economists leans strongly toward action. As Dr. Jonathan Gruber notes, public expansions remain a remarkably efficient and cost-effective way to deliver care to those who need it most, even if some substitution of private dollars is completely inevitable. As we balance precise, rigid macroeconomic models with very messy human outcomes, we are left with a vital question as a society. Is maintaining perfect market efficiency worth the cost of leaving our most vulnerable populations behind? It is where abstract economic theory and human reality meet face to face. Thank you so much for joining me on this explainer, and keep questioning the systems around you.